And then the last thing I was going to share with you, I wanted to give you an update about these urgent cares for those that are listening. I handed out my first urgent care to a shoe store here, and they're handing out these urgent care forms, or these urgent care postcards that I made. Now, when I brought it back to my marketing team, they're like, Don, how are you tracking this? And I'm like, oh, not again. Did I make this mistake again? Because I think we don't think, or I shouldn't, I don't know about we, but I don't think about like tracking stuff. And I think that's one of the challenges when you're doing any type of marketing is we don't have really good tracking, but it's working well. I think this urgent care focus, a lot of people have mentioned they like it because it's something that increases the patients that come into the office, and patients are already looking for urgent care help. Like this week, multiple patients went to the urgent care versus coming to see me first. And one of the patients had a stress fracture on the third metatarsal, and that wasn't diagnosed, basically because it takes a couple weeks to show up on the x-ray. There was another patient, he had a cellulitis and an abscess, and they tried to drain it, but they didn't know how deep it was. So I did an ultrasound, and I could see there was a pocket underneath there, so I had to open it up and have him do packing. And so these are a couple of things that come from urgent care. So I'm trying to kind of cut the line and have them come directly from the urgent care. I've even thought, and I haven't had the courage to do this yet, but taking these urgent care cards that I have and giving them to the urgent cares. So like if someone comes in with a foot issue, say, hey, you came to the urgent care, but now you go to the urgent care podiatry place. I think they might do that if I drop it off for them as well, and I could track how many come from that.